Hi, and thank y'all all for coming to our presentation for the repeat hearing screens for newborns when they have to come back to 2 Northwest for a repeat hearing screen. The objective of our presentation today is to identify the importance for newborns to be tested, to instruct on how to perform the test properly, and to learn how to fill out the proper form and enter it into the computer correctly. Our agenda for the day is to discuss why we do repeat hearing screens for all the newborns that previously failed while in the hospital, and to make sure all nurses know how to set up the test correctly and the importance of placing the order in the computer for charging purposes and faxing to the doctor's office. Why do newborns need hearing screening? Newborns need hearing screening because it's an important first step in helping understand if your baby may be deaf or hard of hearing. Infants who are deaf or hard of hearing need the right supports, care, and early intervention services to promote healthy development. Over 98% of newborns in the United States are screened each year. The American Academy of Pediatrics recommends hearing screenings for all newborns. Here at Jefferson Regional, we do hearing screenings on all newborns after the age of 12 hours. However, sometimes they do fail and need to be rescreened. Ideally, it's best to have it repeated before 6 weeks of age.
These are the steps to follow before screening the newborn. Number 1, make sure the parent has been to admissions. If they came directly to the floor, make sure to call admissions and have them entered into the system for an account number. Number 2, take baby and their parent to the treatment room. Number 3, baby must not have on any baby lotion or oil because the pads will not stay applied. And if you follow along on your PowerPoint photo, it says make sure, scroll down to the second option, enter data and screen baby, then hit the green OK button. This is the second screen, which will come up. Enter patient's medical record number and name. This is the next screen that comes up. Make sure to fill in date of birth and user ID. Initials are fine. How to properly connect newborn to hearing screen. Number 1, how to apply the electrodes. A, black goes on the forehead. B, white goes on the back of the neck at the nape. C, green goes on the left shoulder. Number 2, how to apply the ear couplets. A, the red couplet goes to the right ear. B, the blue couplet goes to the left ear. It works best if the newborn is very still and quiet, so hopefully the baby is asleep and sometimes swaddling will help. And you can see in your photo the actual proper placement for screening. Once hearing screen is complete, print off the results. Make sure the black transmitter is directly pointing to the side of the white machine. Write on clipboard, pass, fail, tester's initials, and date performed.
Okay, and then after that, after the testing is complete, you go and enter the order in the computer and make sure it is complete. Place the strip that is printed out on face sheet, fax that to the doctor's office, and then you fill out the screening sheet, which is also in your packet, and it goes to the Department of Health. And then you place a label on the clipboard, as Kay had said, with a date, time, who performed, and if they pass or fail. And then place the screening sheet which is this piece of paper, and the blue clipboard for the secretary to fill out. And it's very important that you do that so it can be entered. And also to fax it to Children's Clinic. And that concludes our presentation of a repeat hearing screen.
Thank y'all, and please
Thank you.
be sure to fill out our evaluation forms and be sure and sign our rosters.